This is a short videotape to describe a new explanation of the causes of many chronic diseases. It's got a historical background to it, requires the efforts of different generations of doctors, and it provides an explanation for lifestyle causes of chronic disease that are largely preventable. So if we get started, the story starts with this man, Dennis Burkitt. Burkitt was a graduate of Trinity College Dublin, came to prominence because of his explanation of the viral cause of Burkitt's lymphoma. But in the second half of his career, he did a lot of work studying the differences between African and European populations, particularly in terms of their diets and bowel habits. And to summarize his findings in a sentence, what Burkitt found was that Africans produce double 460 grams of stool weight per day as opposed to a European 110 grams, and that Africans tended to go to the toilet twice a day, whereas Europeans could go to the toilet every other day. And these dramatic differences were unexplained at the time. He thought that squatting to achieve defecation was a particularly important aspect and was preventive in some way, but he couldn't articulate the difference between why the Africans had this set of diets and stool weights and Europeans had the other set of diets and stool bowel habits, with corresponding differences in the incidence of chronic disease. Africans had very few, Europeans were infested completely with these different diseases. And the sorts of diseases that Burkitt was interested in were these categories, things like appendicitis, ulcerative colitis, diverticulosis, and then very common things like hypertension, heart disease, stroke, and things like that, including a range of autoimmune diseases. Now, the next important facet of the argument comes from one of Burkitt's students. This is Ken Heaton. Dr. Heaton was a physician in Bristol for many years, and he left us the Bristol stool chart and the Bristol bowel survey. And what that showed was that in 1% of an East Bristol population only went to the toilet once a week, and 0.1% were only successful once a month, which was pretty terrible information at the time that it emerged. But critically, in the context of this argument, 20 to 30% of the population used physical efforts during defecation, either to start or to finish their evacuation. And that becomes very important in the context of this argument. Now, as I've said, Burkitt thought that squatting was protective. And it was the invention of the sitting loo by Crapper in 1860, which actually coincided with the onset of many chronic diseases. And the mechanism is really simple, because what happens when you squat is you deliver a lot of power, takes a lot of power from your legs and thighs to maintain that position, and it's very difficult to strain during defecation. As soon as you take the weight off your legs and thighs, it becomes very easy to strain on the toilet. And there's one class of nerves that doesn't like being stretched. And we'll get to those in a moment. They are your autonomic nerves. Now you have two nervous systems. A somatic nervous system, which moves your arms and your legs, is under voluntary control. And then you have another nervous system, the autonomic nervous system, which supplies all your organs. And it's organized in three main bundles: a cardiac plexus behind the heart, a celiac plexus behind the pancreas, and then two pelvic plexi. It comes in two divisions, a sympathetic division and a parasympathetic division. One sets you up for fight and flight, that's the sympathetics, and your parasympathetics much more for feeding and breeding, to put it in the Wikipedia vernacular. Now, there's been a problem with the autonomic nerves because medicine lost them. and it was a little bit careless after 1945. Here on the left, you have a dissection of a woman's pelvis, and it's been prepared in alcohol, whereas on the right, we've got a dissection of a woman's pelvis, and it's been put together in formalin. And you can see that there's a marked difference between the two sets of material. Here's the sacrum, the pubis, the uterus, cervix, vagina, bladder, and rectum, and all these nerves passing from the sacrum to the junction of the uterus and the vagina. Whereas on this side, you can see that all these nerves are represented simply by these slips of nerve labeled numbers 8, 32, and 33. In other words, the formalin has destroyed the morphology, destroyed the appearance of these pelvic nerves. And successive generations of medical graduates have never seen them. They are out of sight and out of mind. Now, they become very important in this argument because nerves like this don't like being stretched, and if they do, they fray and they break. This is a normal uterine nerve bundle here, relatively sparse in the uterus, but when they fray and break, they look like this, and these give rise to all sorts of painful situations which cause a great deal of inconvenience to many women. Now, these appearances are associated with difficult first labors, some forms of gynecological surgery, and then finally this important one with the straining on the toilet. And in that situation, the nerves tend to be associated or affiliated to these small blood vessels, which have thickened arteriolar walls, and they become very significant in terms of this argument. And they don't just happen in the uterus, they happen all around the pelvis because people strain in different ways. There's at least 2 or 3 different ways of straining. Obstetricians get to see this when they're called to see women who can't deliver their babies in the second stage of labor. And often it's to do with the way in which they're pushing at the time. And often correcting that can avoid the need for an operative delivery. Now, it's significant in terms of obstetrics and gynecology because most of the gynecological syndromes are associated with these sorts of injuries. And in fact, all the great obstetric syndromes, such as preeclampsia, small babies, placental abruption, preterm labor, are associated with this injury. And in this injury, there's a thickened arteriole, but there's this layer of hyalinized cells around the circumference. And all that's happened is during the pregnancy, the nerve sheaths have extended with the vessels to the placental bed, but the nerves have not. And they've left this clue as to the etiology of these injured vessels in the form of this corona of hyalinized cells. So in the pelvis, female pelvis, a lot of the obstetric and gynecological syndromes are all associated with injuries to pelvic nerves. When you look around the rest of the body at the branches of the cardiac and celiac plexi, also you find injuries to nerves. This is in allergic rhinitis. These arrowed blobs are injured nerves, the same in this one. Here's intervertebral disc, and here's myocardium, all the time indicating injured nerves. Here's myocardium again, this is normal, and then here you can see brown fragments of nerves everywhere associated with injuries to the nerves in the myocardium. In pancreas, in type 1 diabetes, you don't see any nerves. There's early marked and selective loss in animal models and in humans, but nobody's advanced a reason for that. And as you'll see, there'll be a number of reasons that emerge from this particular presentation. Hypertension is the same. In a very important paper from 1937, where Moritz and Olt from Case Western in Cleveland described narrowing of arterioles in the kidneys, spleen, pancreas, and adrenals in 100 hypertensive subjects. What we found is that narrowing is associated with injuries to nerves around the vessel wall. So here's spleen with large numbers of injured nerves around it, pancreas showing loss of nerve fibers in the nerve bundle, and adrenal in congenital adrenal hyperplasia with injured nerves here around a thickened vessel wall, and background hyperplasia in the adrenal cortex. In this column, we've stained, this is uterus at the top. We've shown you this picture before and this one, but what this one shows is some stretch receptors in the thickened arterioles, and we think they're very important in preeclampsia, the pregnancy hypertension, but there's no positive staining for P2X3, this stretch receptor, in the other organs. It's very uterine specific. Last year, we found a different pattern of hypertension also associated with injuries to nerves, and this one is fetal hypertension in stressed mothers. So what we found was, here's a normal umbilical artery, here's a thickened umbilical artery, and 3 thickened vessels in the umbilical cord when we've looked by taking sections across the umbilical cord in babies who suffered stillbirth towards the middle or end of the pregnancy. In the next slide, I'm going to show you that inside here, at the just inside the baby, here's the umbilicus, the cord is on the outside. These vessels, the urachus and the umbilical arteries, are on the inside of the baby's abdominal wall. And what you can see is injured nerves associated with the umbilical artery on the right and associated with the umbilical artery on the left. When you look round the baby in different organs, injured nerves all around the baby's organs, including all of those described by Moritz and Alt, namely the kidney, spleen, pancreas, and adrenals. And that becomes significant in terms of the fetal origins of adult disease hypothesis that was put forward by David Barker in 1993. And what he found was that in small babies, that there was a higher incidence of high blood pressure and diabetes at earlier ages in adults. So you had much more cardiovascular disease at an earlier stage in those smaller babies. If you looked in the kidney and the pancreas, he thought it was due to fetal program, but if you look in kidney and pancreas here, you can see the injured nerves around the vessel wall in the kidney. And then there's loss of nerves throughout the celiac plexus behind the pancreas. And we've got to confirm that this is not an artifact of fixation, but we think it's probably, we think it is significant in this context. So what I've tried to show you is different lifestyle causes for injuries to autonomic nerves. The big elephant in the room is straining on the toilet. That's not been recognized as a potent source of injuries to autonomic nerves and subsequent diseases. Difficult first labors. Whenever a woman gets put through a difficult first labors, injures her autonomic nerves, then that produces gynecological complications 5 years later, and they're with her for the rest of her life. So it's very important that we optimize the management of first labors. Different patterns of surgery are often associated with injuries to autonomic nerves. Every time you cut a blood vessel, you'll be injuring an autonomic nerve, but it takes 4 to 5 years before those complications become apparent. Same direct physical injury. Hypertension is an injury to autonomic nerves, and fetal hypertension almost certainly the result of stress, a stressed mother, and the adrenaline and noradrenaline passing across the into the fetal circulation and causing terrible difficulties for the baby during the pregnancy. The consequences occupy all of the headings of a textbook of pathology. A wide range of diverse and varying consequences as a result of autonomic injury. And that's led to a wide variety of chronic diseases of one description or another. So Burkitt and Heaton laid down the groundwork for this, and we've just added a little bit of autonomic injury with some staining of the injured autonomic nerves in different settings. There was another man who came to some of these conclusions as early as 1923. His name was Arbuthnot Lane. He was a leading surgeon in London in the Edwardian era, and in the second half of his career went out and described the benefits of a proper diet, good bowel habit, and exercise to avoid chronic disease of one description or another. So what we've done here is put forward a new explanation of injuries to autonomic nerves causing a great deal of chronic disease. It builds on Lane, Burkitt, and Heaton's observations, and all I've done is added a little bit of immunohistochemical staining in different circumstances to provide some evidence for autonomic injury in different organs in different diseases. There are many other causes of injuries to autonomic nerves, probably many other circumstances that apply to different diseases, but the central principle is that most of these diseases are preventable by optimizing your diet, your bowel habit, and your patterns of exercise. There's nothing here that's genomic or epigenomic or complex in any way. And in fact, Burkitt had said in 1991 that we would waste 3 or 4 decades looking at complex genomic or epigenomic sources of chronic disease, when in fact most of it was associated with our lifestyles. I think Burkitt was right, and we need to take account of this sort of argument if we want to improve our ability to avoid chronic diseases. Thank you very much for listening. That's all I want to say. I'm sure I'll be able to develop this in different arguments in different settings, and I'll post those videos as we put them together.